Hi, I'm Josh McDonald.
And I'm Miranda and we are Hand Therapy Academy.
Let's talk a little bit about treatment planning for rheumatoid arthritis. It's not a population we see a ton of at this point because medications have gotten so good. So chances are if you're seeing someone with RA, you're seeing them either very early on because someone gave them that diagnosis and they're just not sure what to do, but they're on the medications, or they're very, very late and they're older. They started showing signs before they could get on the medications. So, Miranda, what's kind of your starting point for if someone comes in with RA?
Yeah, I will start by saying too, usually my RA patients are patients for life. So I like to keep my hands on these people. I say, hey, you're doing great. I'm going to teach you some things. We're going to get your splinting set up and ready. But then I want to see you in a year and see what changes, if any, have occurred. And if not, that's fine. But there's usually stuff we do with that year appointment that we check up on, like, oh, I'm having a hard time, buttoning my, whatever it might be. So that's usually my RA patients. I always tell them that up front, like, hey, this is not a disease that's going away. It's something that I'm on your team. I want to help you manage it. And I want you to know I'm a resource for you. So that's usually my intro with the RA patients. And then the evaluation, what it looks like, I'm asking these patients what they're having a hard time doing, or what tasks are challenging for them. And usually from that, I can get a pretty good picture of where most of their limitations are. And then, of course, the standard stuff, right? Like I'm measuring how much deviation they have at their wrist, how much range of motion do they have, how much strength do they have. And then I'm being careful, to not have them overuse joints during that evaluation, but basically just getting an overall picture and a baseline of where they're at, and then something that I want to keep track of um, as I see them throughout the year. So that's my starting point. How about yours?
A lot of the same things. I kind of treat it almost like an incoming osteoarthritis patient or EDS, where I'm covering a lot of the joint preservation and energy conservation concepts and talking about, using big joints to hold your book. And I like your idea. I do that too, where I ask them to make lists and like, let's just make a quick list of things that are a little bit hard to do, things that you can't do, and things that you wish like we different categories and things. And so it gets me focused on things that are important to them. And that's what we spring off of for energy conservation. Like, oh, I love playing cards with my friends. Let's talk about something that holds your cards for you. Or I love cooking. Let's talk about adaptive kitchen things, or taking breaks while you're cooking, and all that energy conservation and task modification stuff.
Yeah, I think it can really guide where you're going. So then once you have so my next step is, once I have my problem list, then I'm going over through all the things that are going to address the problem list. And when you get down to it, a lot of the problem lists are all very similar, right? When you
Yeah.
start breaking it down. So, what is some of the go-to treatments that you're giving to almost every RA patient, no matter what?
I give them um, some comfort level with using modalities. Like we have the hot packs in our clinic, and they all love the hot packs, but you can't take those things home. And so I like giving them some way to manage with whether it's neutral warmth from gloves. Grace and Able has great gloves. There's some iMac on Amazon. There's good gloves with neutral warmth. Or if they're going to use paraffin, if they're going to use hot packs at home, just something where, hey, this feels better and it helps my hands move and get more mobile for functional activity, maybe beginning of the day. And so I like to give them some construct of how they can apply modalities at home. But then I also talk a lot about adaptive equipment. And like you said, a lot of these things are very similar. I read an article that said like 91% of adaptive equipment things in the home are kitchen based. The rest of the chunk is a lot of times like gardening and outdoor based because that's where we're applying load through our hands. So we have our basket of stuff. We go through Amazon together and just talk about here's the library of things. Maybe this one, the button aid you don't need for a year or two, but you know what's out there. Maybe a jar opener would be helpful now, even if it doesn't hurt. Let's make it not hurt in the future.
Yeah, definitely getting them prepped for what it looks like. And then I always try to stay away. I don't know if you have those like catalogs, those functional catalogs.
Yes.
Like I love those because I think they're great to give out. But then I'm always like, gosh, they're going to think that, you're kind of like, how do you like bridge into that with them, that they're going to need adaptive equipment? Because I think
Yeah.
that's hard for people, right? Especially early on.
And so we have a basket, this little basket that we bring out, and it's got a bunch of just random like Amazon stuff and an adaptive mouse and a button hook. And I say, like, listen, you don't need this one now, but I still intentionally go over it with them and say, you don't need this now, but you might someday in the future. So just know that it's out there. Zipper pull on one side, button aid on the other. And I don't think I've ever had someone say, yes, that's exactly what I want. But I know that there's someone who's going to like remember that later. So, and then I kind of take them down the rabbit hole of Amazon. And so we chat about Amazon and all that. So it's, yeah, it's important for them to know that this is, they're not just making choices about adaptive equipment now or energy conservation now. It's let's expose you to the concepts. And then, like you said, come back in 9 to 12 months and let's see what's giving you, what's on your problem list now. And let's check those things off the list and then come back when you have a new problem list.
Right. And so much of our education is telling them to preserve their joints, right? Like your joints have to last for as long as you do.
Yeah.
So we might as well decrease the load on some of these joints so they can last that long. Or, maybe we wait so they don't have to have a joint replacement as soon or, whatever it might be.
Yeah. Yeah. And there's a lot of really good research that says that they will have better overall outcomes, not just hands, upper extremity, whole body, if they stay active. It doesn't have to be jogging or high impact stuff. It can be going for walks, going on a stationary bike or bike riding if they can, time in a pool, low impact stuff. The more light activity they maintain, the much better they're going to be long term because they're keeping those synovial fluids changing over and not letting them get thick and stuck and breaking down.
So what is your favorite exercise that just overall exercise in general that you recommend to these patients?
So normally I'll say walking, but in Arizona here, when we get in the summertime, we've got probably, 5 months maybe, where I can't tell my 75-year-old rheumatoid arthritis patient go for a walk. Like that's the easy thing. So maybe it's going, we have these retirement communities in Sun City out by us, and there's all these like walking pools where it's almost like a maze that they just zigzag through. So those kinds of things, if they're comfortable swimming, it's a great option in the summertime. But walking is kind of my go-to if it's not middle of summer.
Yeah, walking is a great one because you don't have to go anywhere for it. But
Yeah.
I'm like you. I always tell people, do some sort of, water aerobics or some type of water exercise so you decrease the load on the joint.
Yeah. And there's a bunch of like silver sneakers and programs that are like, here's yoga, but it's not a bunch of planking that's hard on your hands. Here's some Pilates stuff, but again, it's not, it's joint friendly. That's going to be geared for that population.
Right. Or if there's a specific exercise that they like doing, I think that's fun as a therapist to go through the different positions and be like, oh, that's a bad one. How can we change it?
Yeah, yeah. And I never want to tell someone you shouldn't do that activity anymore. But I had a patient who came in and loved pottery. And we had to have a conversation about what about pottery is important. Could you teach pottery? Could you hang out with your pottery friends? Because really working that heavy clay is tough. And so if it's an exercise, and I don't want to say don't do that one. Let's see if we can find some way around it or find what is meaningful and utilize that as instead of the stressful task.
Yeah, that's a really holistic approach.
What do you feel about like exercises that I might give? Putty, buttons, like the actual things off of my hand therapy clinic shelf. Are there many things or handouts that you would give?
Oh, definitely not. Most of these patients are overutilizing their joints
Yeah.
anyways, and they have to, right, for function. So there are a few exercises that I'm going to show them to target specific things. Like I'll do radial finger walking where they walk their fingers to the radial side. And then I'm always like, but stop, you're not going to go to the ulnar side, right? So I'm always educating them on that. I'm showing them deviation of their wrist, to help. I'm basically working against the deformity. So the direction of the deformity, I want to go the opposite direction. So I tell the patient that, and that usually makes sense to them. So I will usually do that. Usually I'll do tendon glides, but not too many. I just want to maintain the tendon glide that they do currently have, as well as, especially I think the hook fist is a good one with these patients. But so I'll go over that, and I feel like that's about it. But we're not doing that. I'm not having them come into clinic and do that every time, right? So I'm telling them to go ahead and do it. I want to check that you're doing it correctly. And maybe you do this once a day and we go from there.
Yeah, this is a patient I'll see 2, maybe 3 times if there's some splinting involved, but it's going to be very simple. I'm teaching them some exercises and then having them come back and check in. I'm not doing putty. I'm not doing all that stuff. I might have them do like sifting through rice and just kind of light kneading. It's almost like a cool modality as opposed to like a sensory reeducation and kind of turning the dial down on pain more than it is finger mobility stuff. But yeah, this isn't a see them once a week for a couple of weeks kind of patient.
Right. And for these patients too, I always say, hey, like, I'm going to put you on my schedule in 6 months or whatever I think is appropriate for them. And I also think that gives them a little bit of accountability, like, oh, I know I'm going back to her. So I'm going to make
Yeah.
sure that, I keep up on some of this or, because I think we all probably struggle with accountability at times, especially for things like finger exercises.
We all have little exercises we know we're supposed to do, whether it's rotator cuff or abs or whatever, and we don't do them unless we know someone's going to ask us about them.
Right. That's right.
All right. Well, hopefully this was helpful, giving you a little bit of idea of what we would do or how to treat someone if they come into your clinic with rheumatoid arthritis, kind of what your focus should be and how to help those patients. If you have any other questions, you can reach out to us via email at info@handtherapyacademy.com or on our social media platforms with the handle Hand Therapy Academy.